So as you saw on the slideshow, very recently in 2015, C2C embarked on sponsoring a study between the UC Berkeley School of Public Health with the Harris-Manchester College of Oxford University. This relationship came about very organically. My mother, Jaja, is a graduate of the School of Public Health in UC Berkeley. My father, David, actually sits as a board of regents on the Harris-Manchester College of Oxford University. And C2C basically sponsored a 3-year summer research program where a faculty member or a senior administrator at the School of Public Health gets the opportunity to spend a week in Oxford enhancing a research interest, whether that's through discussion, research, collaboration, partnership with Oxford counterparts to further an area of research. And this year's recipient is Arthur Reingold. And I'm going to ask, before I ask him to come up, I'm going to have the Dean of the School of Public Health, Stefano Bertozzi, to come up and speak briefly about this project.
Thanks very much. I'm not going to say anything about the project. I'm going to let Art say something about the project, but I will introduce Art. I actually knew about Art before I knew about anybody else at the School of Public Health. I'd spent my life working on AIDS in developing countries, and I'd been working in Geneva. And back then, we had a lot of work to do with our colleagues in Brazil, because Brazil was instrumental in reducing the price of antiretrovirals to treat HIV. And at the time, there was a standing joke, it seemed to me, among my colleagues who had been or were currently the directors of the National AIDS Program in Brazil, that one of the qualifications necessary to become the National Program Director was to have been mentored by Art Reingold. And so I knew about this guy in Berkeley who was famous for the mentoring that he'd done for people all over the world, especially through I think it was about 28 years in total that Art has been running this training program with multiple countries. So when I got to Berkeley, I discovered a colleague who just does an extraordinary amount for the school, and recently nominating him for an award, I remarked that Art teaches 5 times as many students as the average faculty member at the school, and hundreds more credit hours than anybody else in the school. He does that at the same time as he's the head of the Division of Epidemiology, which has the privilege, if you're the head of the division, of being able to teach 1 course less than you have to. So instead of teaching the 2, instead of 3 that he could teach, he teaches 8 or 9 depending on the year. In addition to that, he serves on lots of really important boards, current and past. He's advised the Centers for Disease Control on the choices of vaccines for the United States. He sits on the board that does that for the World Health Organization. He was the spokesperson for the university on Ebola over the past Ebola crisis in West Africa, and supports students who do research all over the world. In addition, he's also the director of our 1-year epidemiology program, which brings over mostly physicians from both the US and from developing countries and trains them in epidemiology. He's published over 300 papers. He's really extraordinarily committed to service, but also a real scholar. In addition, he's part of a power couple. He's rarely here on weekends because his wife, Gail Boland, next to him, is the director of sexually transmitted disease prevention for the country, based in Atlanta at the Centers for Disease Control. But fortunately, she's here this weekend, and so we get both of them. So with that, Art, I wonder if you could say just a couple words about what you're planning to do with Oxford this summer.
So thank you for that kind introduction, and I particularly want to thank Jaja and David for the extraordinary opportunity that I had through this program. I'm somewhat of a fraud because clearly a lot of the emphasis here is on mental health, and an extremely important topic. My interests are a little more in the area of infectious disease prevention and control. There is an overlap. The project that I actually spent time on at Oxford relates to trying to make sure that children are appropriately immunized. We have a large project in Alameda County working with the Oakland Unified School District with support from the Page Family Foundation to try and make sure all children receive influenza vaccine for free at their schools. And so being given the opportunity, I should say that the school, I believe almost half of our faculty work in global health and internationally, and certainly many of them would have been at least as qualified and interested in spending some time in Oxford. So I'm not entirely sure why I was chosen. For me, it was a wonderful opportunity. As a graduate student, I spent a year of my PhD training at Oxford back in the early 1970s. So for me, it was a wonderful opportunity to be back in Oxford, which some of you, I suspect, know Berkeley's only about 150 years old as a university, but some of the colleges at Oxford are over 900 years old. I suppose in China there might be older universities than that, but Oxford is certainly an extraordinary place. And so for me to have the opportunity to spend a week there working with colleagues and thinking about my work and how we could improve it was a great opportunity. I will say that my wife then joined me, and we did spend then a little bit of vacation time in England as well. But in any event, it was really an incredible opportunity. It's emblematic of the kind of work we at Berkeley are privileged to do, working with universities and students and colleagues from around the world. It's really contributed a great deal to my work. So I really want to thank you very, very much for the opportunity. Thank you.